Yes, we are live now.
Yeah. So, good evening, everyone. First of all, wishing all of you a very happy Diwali on behalf of Foxy team and on behalf of all of us present over here. I would like to welcome our Foxy President, Sunita Tandulwadkar ma'am, and also our guest today, Dr. Ambuja Choranur ma'am. So, it's indeed a matter of pleasure for me to welcome all of you today. And today is the 264th episode of the podcast series that we are doing, the Gyan Pravah series, which is a initiative of our president, Dr. Sunita Tandulwadkar ma'am. Ma'am has always been I would say, a spotlight. She has always given us a lot of, a lot of work throughout the year, and also a lot of, she has given us a lot of food for thought actually, because the way the year has gone ahead, it has been a total roller coaster. So, ma'am, thank you so much once again for trusting us, for giving us this opportunity, for this excellent initiative of conducting this Gyan Prava series every day at 8 p.m. onwards, and that we have done right from the beginning of your tenure. It's an excellent Herculean task that you have taken through, ma'am. So I would like to welcome Sunita ma'am to this platform, and I would request her to say a few words of blessings to everyone present over here.
Thank you, Priyankur. Thank you. Double thank you. One, doing your work very sincerely throughout the year. You are one of my best chairperson. But also thank you for getting Professor Ambuja Madam for our podcast today. It's an honor,
Thank you.
Madam, to have you on our podcast series. It's one of the best. I know it's very taxing to join every day at 8 p.m. But believe me, first 2030, I felt it's too much. Whether you are on a stage or you are on the airport, you are connecting, you are stopping your OPDs. But
I know.
afterwards, I realize I get an opportunity to meet such a stalwarts. Everyone, whether academic or non-academic background, we have politician, philosopher, spiritual person. So it's one of the best experience. I'm meeting so many dignitaries, faculties of national and international repute. And I just joined for 2 minutes, ma'am, to show the respect from the Foxy that you are taking out time and are on a Foxy platform. So thank you,
Thank you.
Madam Ambuja, and it's honor to have you and lovely to see you.
Thank you, Sunita. So nice of you.
Thank you.
Also, if we can make your screen tilting, so we will see you. Yes, ma'am. Thank you. Thank you. So people will love to see the lady completely. That's
Uh-huh.
beautiful. And our protocol is, ma'am, you and Priyankur are the only one in the viewers. I just joined for the viewers, I joined the viewers link and I will be listening to both of you from there.
Thank you so much,
Sunita,
Sunita.
every day almost I am attending your podcast. It is so wonderful. It is attracting people.
Yeah.
And I'm really thankful to you for giving me the opportunity to participate in this podcast. And I will tell you, you are a real dynamic and real visionary. And your brilliance, I cannot explain you. And you're a reservoir of knowledge. Always thinking, either you're in the house or in the airport, always thinking what next, what to do. That is how this program has become so successful. Thank you very much. I will say that you are inspiration to all of us. Thank you.
Thank you so much once again, Ambuja ma'am. Thank you, Sunita
Thank you.
ma'am, for being here. In spite of the Diwali, in spite of whatever it is, every 8 p.m. we see you, and that gives us, that at 8 p.m. we wait. Okay, we are going to see our president today, and that
Yeah.
is a matter of inspiration for all of us, ma'am. Thank you for always being there and for
Thank
always
you.
supporting us.
Thank
Thank
you.
you so
And
much, ma'am.
I'm just always, I thank God for giving me best of the chairperson. Every chairperson is doing it so beautifully. They take out best of the faculty they select, and then their podcast is fantastic. And most importantly, is they don't compare with each other. They see to it that their next podcast is better than their previous. So thank you, Priyankur, and love you all, and happy Diwali again to you and all the viewers
Thank you.
over there. Thank
Thank
you.
you so much, ma'am. Thank you.
Thank you.
So we move ahead with this webinar today, with this podcast today, and of course, I would like to again formally welcome our our guest today, Dr. Ambuja. Ma'am is a menopause specialist practicing in Hyderabad. She has been a retired professor and head Department of OBGYN at the prestigious Osmania Medical College in Hyderabad. She has been the past president of the Menopause Society of India, and it's always a pleasure to listen to ma'am. I have attended many webinars of ma'am regarding bone health, and those are the best bone health webinars that you can attend, pertaining to the fact that she clarifies from physiology to pathology to everything regarding to bone health, and that's perfect. Thank you so much, ma'am, for taking out time. Thank you for giving us this slot on the Diwali day. I know it's a festive season. Everyone is, busy have holidaying, but it's like a task for us. But then I think it's a task that people are going to enjoy today. Thank you so much, ma'am, for taking out time and joining us today.
Thank you, Uncle.
So,
Thank you,
ma'am,
Priyanka.
thank you so much, ma'am. Thank you so much. So, ma'am, with this, we will start off with this session today. And of course, first of all, we need to understand probably what osteoporosis is. And with that, I would just like to briefly ask you, ma'am, how do you define osteoporosis and what relevance does it have to the gynecologist in pertinence to menopause?
Yeah, good question starting, Priyankur. Before that, give me 1 minute to wish all the viewers and you all on Diwali Day. And yesterday being
Absolutely.
the World Menopause Day, I wish everybody to have a good bone health. And it is a pleasure for me to talk about the topic which is overshadowed and especially in the postmenopausal women. And now coming about to the definition which you wanted, we have so many guidelines, WHO guidelines, Foxy guidelines, and all. But what WHO says is it defines osteoporosis as a systemic skeletal disease characterized by low bone mass and microarchitectural deterioration, leading to increased bone fragility and fracture risk. It looks so big, but National Institute of Health defines it as decreased bone strength and propensity to fall. Bones cannot exist separately without muscles and joints, so it is a musculoskeletal disease. I'll tell you why it is important for the obstetrician or gynecologist is osteoporosis is a silent epidemic, asymptomatic until fracture occurs. With growing elderly population, it is emerging as a major public health problem. And believe it, 30% of the postmenopausal women in India are osteoporotic. Globally, 1 in 3 women over 50 years experience osteoporotic fracture. Once fracture occurs, they when about 30% of the people they will succumb within 1 year and 50% will have long-term morbidity. This figure is higher than a combined mortality that occurs because of the heart attacks or for cancers or anything. That is the depth of osteoporotic problem everywhere globally. For gynecologists, the menopause transition represents a critical phase where estrogen deficiency is there. Women can lose about 20% of the bone mass within 5 to 7 years of the menopause. That's not the case with the men. Typical osteoporotic fractures commonly, I think all of us see, is for the hip or for the vertebra or for the wrist. It is a social and economic burden to any country. So we need to protect the bones. Hello, Priyankur? Hello?
Ma'am, you're audible, ma'am. Please go on, ma'am.
Yeah, yeah.
I'm so sorry.
You wanted me to know only
Yes,
about the
yes,
gynecologist point of view, no?
yes, absolutely perfect, ma'am. Please go on. We are all listening, ma'am.
Yeah. And then next question comes, what is the role
So, ma'am,
and how broadly we can identify?
absolutely. So basically, what I wanted to ask you next, ma'am, you have beautifully highlighted the points that you have already said. Next, I would like to ask you is about what do you feel is the role of a gynecologist and how do you be identified? We all talk about the the BMT, we all talk about the Z score, etc. But clinically also there are options, and how do we, as a bone health specialist, how do you train us to, to diagnose this early so that we do not, this osteoporosis in this woman can be prevented.
They forget about the specialist, but we are the first point of patients coming to us, especially in the midlife period. For so many other reasons, they will approach us. So it is our duty to tell them and counsel them regarding the bone health. For any other things come, it is the opportunistic counseling we should do for the patients. Why it is important, I'll tell you. Prevention is possible. Don't say that without nothing can happen. It is never too early or too late. Osteoporosis is not inevitable. Early screening, lifetime measures, and effective therapeutics can build and preserve bone strength. So, we should tell them how to screen and what are the things that are necessary. One, all of us know gender is a thing that all women will suffer with the osteoporosis. But there are high risk factors we have to take care whenever we are taking the history for any other reason. One important thing is the early menopause before 40 years, or family history of fractures, or thin patient, smoking, alcohol, or junk eating. 1 minute. I'm in a webinar. Please call me later. Or any chronic illness, if the patient comes like rheumatoid arthritis, thyroid, you should be always careful and in screening the patient. So early screening and assessment is necessary. As you said, BMD measurements like DEXA and all we do. More than anything, clinical assessment is very important. As the patient walks inside the room, you see how the patient walks. Is she stable or not? And is she bending down like that? Whether there are any silent fractures? This is what is called the Downger's hum. Means if you ask the patient to stand against the wall, she will not be able to touch her occiput to the wall and she bends down. With each vertebral fracture, the height of the patient comes down about 1 to 2 centimeters. If more than 3 or 4 fractures are there, maximum about 4 to 6 centimeters for less will be present. So with that, what happens, the bone rib cage comes very close to the pelvis, and so you cannot even insinuate 4 fingers. Their difficulty of breathing also will be a problem for these people. And with multiple fractures, all the problems will come.
Perfect, ma'am. So as you said, ma'am, of course,
Shall
since
I
we
tell you how to identify this? What is the best things?
yes, ma'am, please do that, ma'am. That would be great because on
Yeah.
on practical aspect, how do people identify it as a gynecological perspective? If you can tell
See,
us, that would be
with
great.
this, we are going to suspect that she will have the osteoporosis. And confirmation is by the DEXA scan, that is the gold standard.
Mm-hmm.
And it is not easily available everywhere, especially in the rural areas. We are doing the small ultrasounds also, but that's not so accurate. At least something is better than nothing. DEXA scan is perfect. It is the gold standard, tells how much is the BMD is there. Along with that, some of the blood investigations like vitamin D, calcium, her thyroid levels, blood sugar, hemoglobin, because they all come under the high risk factors way. We have to do it. And next thing is always preventive aspects we should talk to them. Like lifestyle modification. Always therapy is latter. First is lifestyle modification. You tell about the nutrition, her weight bearing exercises, and fall prevention measures, what she should take. Then only comes the management with the drugs, not before that one.
Perfect. Perfect, ma'am. So, ma'am, of course, one of the key things that we all know about when we are talking about osteoporosis is the dietary factors. So I'm
Yeah,
sure there are dietary factors that we can attribute to these patients, which will help us or help them rather in preventing this osteoporosis. So can you give us some tips and tricks about the dietary factors which will be
yeah,
beneficial to them?
definitely. See, we are there. What we eat, that only depicts that one. So I always insist on my patients and I tell them what is locally available food for them. That's very important. Stop eating junk and balanced diet, homemade, and avoid Coca-Cola or once in a way is okay, but drinking, smoking is not a daily affair. And we were in olden days, we were thinking that ladies will not smoke, but it's not correct. And especially in our Telangana area, a lot of drinking, this toddy and all is there, and chutta they smoke. So we should advise them not to do all these things and insist for calcium rich foods. Not that for everybody we should supplement with the calcium and vitamin D. We should insist for the calcium rich foods. And everyday requirement is about 1200 milligrams per day. It need not be supplemented from outside. The calcium rich foods you should tell that is the dairy, milk, buttermilk, or ragi, sesame seeds, leafy greens. Many people they don't eat, and then fortified foods. In India, we don't take much of fortified foods, but these are the things that are available. After all these things, you should tell them to take the supplements. And second thing is, even though they take good food, proper absorption is not there because of the lack of the estrogen in the postmenopausal period. Absorption from the intestines is less. Second thing is, vitamin D absorption also will be delayed if calcium is less. But all of us know there's a lot of vitamin D in the sunlight. But where are we exposing ourselves to the sun? Because it should be between 11 o'clock to 3 p.m. We don't go out. AC cars sitting in the house and AC rooms. There is no way that diet can supply. So vitamin D, it needs to be supplied from outside. Of course, fish is a very good source of vitamin D. And
Perfect,
tell
perfect, ma'am.
them excess of coffee, caffeine
Yes.
drinks, this they should avoid. And they, even if you take good calcium, if you take more of coffee and all, it limits the absorption of calcium that we should enjoy. The third thing that's very important is taking a proteins. Already in the egg, it is accompanied by the muscle or the muscle person when the proteins are necessary. Minimum of zero point 0.8 grams of gram per day. Protein is necessary. Like everyday meals, whatever we take, the cereals, and if they are not vegetarians, well and good. All the mutton, chicken, all these things will have good proteins. But we should see that millets, cereals, all these things we take along with them. Supplemented the last one. Good food is very, very essential.
Per- Perfect, ma'am. Beautifully highlighted the points. Can I ask the support team to kindly switch on my video? I'm somehow not able to switch on my video again.
Yeah, your video is not there, and even my video also is not there.
Now I can see you, ma'am. I hope you can see me as well. Yeah. So thank you so much, support team. So, ma'am, of course, after that beautifully enlightening about diet and nutrition, the things that you talked to us about. So, next thing that I would like to ask you is about the role of exercise. I'm sure exercise plays a very important role. Many of us neglect exercise as much as possible. They off late, I have seen patients who come to me and just ask, doctor, how do I lose weight? But then, these are not menopausal women. These are women in the reproductive age group, infertility, which they
Yeah,
primarily
yeah.
see. But they are not ready to do exercise. All that they want is, now they have heard about these medicines like Munjaro, etc., that have come in, and they
Yeah,
talk
yeah.
about only that, but they don't talk about exercise. So that doesn't help. So how in
Exercise.
osteoporosis,
Yeah.
I know, ma'am, in menopause it helps a lot. So will you highlight us about the role of exercise in preventing
Yeah.
osteoporosis and
Before
improving the bone
going
health?
to exercise, Priyankur, I just
Ma'am,
want to tell one thing.
ma'am,
Our people, they'll go on eating so much. They don't think of this restricted diet. Nowadays, it is the Mediterranean food is very good, which is plant-based, and there are fruits, vegetables, whole grains, nuts, olive oil, so many things. And time restricted eating is very good. In our parents and grandparents, they used to do ekadasi. Do you know? Means,
yes,
and
ma'am,
then some of the times they used to fast for some of the gods, like Saturday
absolutely.
Venkateshwara Swami and when Shirdi Sai Baba for Thursday, like that. So it is very good. It is a scientific basis. That is, time restricted eating will be there. Intermittent fasting. It can be about 8 hours, 10 hours fasting, 12 hours fasting, whatever it is. Each person will have a different thing. But that is very good because of the fasting. You will give that some time to recover. Otherwise, always eating is not correct.
And that to eating unhealthy food, eating food that is not healthy for the body. Sometimes the patient, all that they eat is junk food.
Yeah, regarding exercises, as you said perfectly, it is correct. I mean, nowadays ours is sedentary life. Either it is a housewife, or we are working, and especially from the time of Corona, all working people also work from home. And what gadgets we are not having? We have a grinder, cooker, everything. And except for watching the cell phones, we don't spend any time for walking or anything like that. So we should insist for the exercise. Movement is very crucial. Weight bearing exercises like brisk walking, dancing, stair climbing, all these things are very good. And balance and posture exercises means walking on a rope or climbing the steps. These are also very good. And nowadays, one more thing that is there is Tai Chi. Means this is a Japanese exercise where flowing movements with the deep breathing and focused mindfulness, which can help
Okay.
improve balance, flexibility, strength, and reduce the stress. See, like this, they will put it and then slowly they'll walk and they'll do meditation along with it. So, stress reduction also will be present along with it. So, we don't need to go to gym or anything to do all these exercises. Go to the shopping, get vegetables in two hands. That itself is a weight bearing exercise. So
Absolutely.
it gives both walking and better to stand on one leg so that sometimes, not always, you can stand sometime and see that you will have some stability. Ideally, postmenopausal women should aim to do 30 minutes of their time for exercises at least 5 days a week.
Great, ma'am. Thank you so much for enlightening that, ma'am. Ma'am, now tell me something. Of course, you being the head of the Indian Menopause Society, plus you have a collaboration with many international organizations as well. Ma'am, when we go abroad, we see a lot of women, especially in the upper, I would say the upper limit of the age group that's beyond 60, 65, probably the menopausal women. They basically, ma'am, they're obese because of probably sedentary lifestyle, because of the food habits that they have, etc. So, ma'am, how do you see the bone health in the woman in India, and how do you see the bone health of the woman in foreign countries? And what do do you feel that Indians have? Because I was reading through an article which said that Indians have poorer bone strength than that what the Western women have.
So how do you attribute that, and what do you say to the Indian women to do extra probably so that they do not lose that extra bit of bone mineral density?
It's a very good question because we see for when any of the advanced countries like America, Australia, they're quite fit even at the age of 90 years. They go for shopping, they sell the things and all. But our people, 50, 60 years itself, they will walk so slowly and all. Bones cannot be built up overnight. It should start from the childhood itself. It will start in the childhood, stabilized in the adulthood, and we can continue in the middle age and continue in the menopausal age. For this intrauterine life and mother's calcium and taking care of the antenatal thing is very, very important. From where the bone mineral density starts accruing, we should insist and say that the bone mineral density accumulation is only up to 30 or 35 years. Afterwards, it will be maintained as plateau. So that time doing lot of exercise, stop eating junk food, eating good food. We don't say that you should not eat junk food. That is the age everybody will eat. But eat first at home and then go for the junk. Eating two bananas is so good. Eating a egg, eating milk, drinking milk, drink all these things. See, children can digest anything. So after all these things, you can go and eat your junk. Nothing will happen. That's what is very, very important. And as I told you, no, the opportunistic counseling is very important. You, whenever they come, either in the childhood, adulthood, after pregnancy, or for anything, you keep your things on the board. You can say how to do the screening, like DEXA screening, or the prediction of the bone health is very much important. Means 10 years prediction is possible, at least for our setup. Indian, there is something like ASTA. Depending upon weight and height of the patient, we can tell whether they are vulnerable for the fractures or anything like that. You keep everything on the table and explain them. That definitely something or other. 10 times if you explain, at least 11th time it will get into their brains. See, we can take the horse to the pond, but we can't make it drink, no? At least
Perfect.
try sometime. You will succeed in doing
Succeed.
the sort. That little amount we should do for our country being doctors.
Absolutely, ma'am. Perfectly said. Thank you so much, ma'am. Now, ma'am, you talked about the Japanese method of Tai Chi, and that's something that has come in today and that people are following. But what do you say about the about yoga? Because I think in India, of course, coming from India, yoga is something that has gone from India to the outside world. So, yoga, does it help? And what is your opinion about probably the freehand exercises that this women do at home? Do you think that helps in decreasing the osteoporotic quotient in these patients?
Yoga is not exercise. It is a type of movement keeps your body fit for any of the works you do. But doing Surya Namaskar and this everyday movement exercises, they are all very good. But what is going to give strength to your bones is running, walking, weight bearing exercises are necessary, or lifting the weights. These are the things that are necessary. Yoga, yes, stress will be reduced. You will have a good peace of mind. Along with that, a good sleep. All these things are there. But it is only the way of living yoga. But exercises are entirely different. You need to move. Always you need to move. Don't sit idle like that. Move. It is a very good thing.
Perfect. Perfect, ma'am. I think very beautiful message that has gone in today. And I think this is for everyone who's hearing this. The important message that ma'am says movement is very, very important. Once you become sedentary, once you stop moving, you get into the risk of osteoporosis. You stabilize, you stop mobilizing your body, and that sort of, gets your body into a thing saying that, okay, so basically it's not going to be help me in towards osteoporotic quotient, and also not going to that livelihood that we talk about. WHO today's day does not say old age is more than 60. They say
in the 60 is the new youth. So we have to keep mobilizing, we have to keep moving. And the second important thing, which I tell to a lot of my patients as well, most of them say, I do morning walks, sir, but still I do not lose weight. But remember, the morning walk that most of the people do are chit chat with the society friends, where they
Yeah,
go out
that's
on a
correct.
stroll in the morning, they chit chat about the house, chit chat about the mother in laws, and they come back home. But that does not help. You have to sweat it out, you have to run, or you have to walk in a pace that you sweat out, otherwise, it doesn't help.
One
So
more
thank
thing,
you so much.
in Indian
Yes, ma'am.
circumstances, they get married very early and they will have children and they will become mother-in-laws very soon. Once they become mother-in-laws, their mental status is they should not work. Daughter-in-law is there to bring coffee, daughter-in-law is there to do everything. So that mental attitude should change to them and they should move and do as much as they can. And that's going to solve the problem. We are not able to hear you.
Yes, ma'am. No, I could hear you, ma'am. I was just talking over here, ma'am. So thank
Yeah,
you so much, ma'am, for that insight once more. Now, the next important thing that I would like to ask you, ma'am, is regarding you have talked about to us about the supplementation. You have talked to us about the exercises that we need to do, ma'am. I also need to ask you because there are instances where we see that some of the women, because of the osteoporosis, get fractures. So post fracture mobilization is a concept that has come in now. And do you feel that this osteoporotic woman, once osteoporotic, is it always osteoporotic, or this woman can still, try to decrease the chances of fracture in them later on in their life?
no, once osteoporotic means, yes, it is there. But drugs or anything, it will not allow it to progress. It will stop there. That is why one thing is you should prevent becoming osteoporotic. Once they become osteoporotic, don't allow them to progress. So that's where the medicines help. So then, shall I tell about the medicines a little bit? Yeah. People
Ma'am,
think that,
I will just take that a little later. Once we come to the HRT section, I'll take the medicines from you. But before
yeah,
that, I have got one more important thing that I needed to talk to you, and that was regarding the DEXA scan, the screening. Because a lot of us do not still have the concept clear in our mind. How often should we advise our women to get the DEXA scan done? And at
yeah,
what age, what BMI should it be done? Ma'am, I would like to take the screening and monitoring first, and then we will come to the treatment and the medications for this woman.
yeah. Good question. DEXA need not be for everybody because people will come and ask. So many people, especially working in the IT departments, I have the full body scan. I can get it done. So get me DEXA. It is not necessary for a person without having any diseases. Not hypertensive, not a diabetic, and not a fatty person, normal BMI. DEXA is indicated after 65 years. After 50, below 50, if you are advising, means it is for the high risk people. Or the who are the those high risk people? Very fatty person, or diabetic or hypertensive, or obesity is another thing, or very thin person if they're both ends. And if they have a smoking or any other rheumatoid arthritis, and especially nowadays, for many ailments, patients are receiving corticosteroids. If they are taking corticosteroids, more than 7.5 milligrams, more than 3 months, they are prone for fractures. Those are the people they need any DEXA to be done. And once we do the DEXA, it need not be repeated every 6 months. It should be repeated after 2 years only, not before that one. And especially important thing is, suppose if it start them on medicine, while they are taking anti-substitutes or anything, don't go for DEXA. It gives a wrong report. So that we should keep it in mind. Otherwise, we'll write and they will come back with some report or anything, factitious report and say, it is like this, what do you want me to do, this thing and that thing. So these things they should take care.
Perfect, ma'am. So beautifully highlighted about when to do it, and you also told us how to interpret it, because that is important again. We cannot just interpret it in a way that it doesn't help and it's of no use. So basically, thank you for highlighting the point of how to interpret it and also when to do it. Now, ma'am, also apart from DEXA, do you also look at the BMI, like you said, the age of 65?
So do you also look at the BMI, and based on the BMI, do you advise DEXA, or is it the same guidelines as you said for the age of 65 years that you just mentioned?
No, that's what BMI, if it is less than 18 or BMI more than 30, and especially 40, when severely obesity, they are the people who are high risk. For them, it is at the below 50 years itself, we advise them to go for the DEXA. And
Lovely.
second thing is, DEXA tells not only about the BMD, it tells how much of the fat that is there in the body. Lean fat is how much, and what is the fat that is accumulated, how to control. This is what is the one propensity we can make out with the DEXA. So that's a very important thing. And second thing is, DEXA at a particular point we should get it done. Either it is in the hip means trochanteric region. If it is osteoporosis that is there, it says it predicts fracture at the hip fracture. And if you go to the spine osteoporosis, if it is present, it says whether vertebra are going to be fractured. It predicts vertebral fracture. That's what is the importance of it. And never treat BMD numbers. Never treat. But every patient should know what is their numbers. Depending upon the patient, individualization of the treatment is essential, and don't treat BMD, because so many times nowadays it's a fashion to call the doctor on phone and say, this is my BMD, do you want me to take anything? No, 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 don't treat. Unless you see the patient, don't treat them.
Absolutely perfect. I think the important another point that you made over here, ma'am, see the patient and also look at the risk factors. It's not only the BMD number that matters, but
Yeah,
also the
number.
risk factor that is important. Perfect. Ma'am, the next part of the screening quotient I would like to ask you, in a menopausal clinic, apart from the DEXA scan, are there any other tests that you advise them? Do you routinely tell them to do a lipid profile? Is it important for us to do an echocardiogram? Is it important for us to do a estradiol or a progesterone level? Are these things important for us to advise this woman in the menopausal clinic?
See, the basic investigations I already told you: hemoglobin, blood sugar fasting, and postprandial thyroid estimation. That's very, very essential, because estrogen absorption will be altered because of the thyroid what we take. And then that comes the prediction of the osteoporosis by doing we have the osteo scan, we'll keep it and do it. And lipid profile is very, very essential.
Yes.
And liver profile. Liver profile we better to do, because many of the people at the old age, they will have fat accumulation in the liver. Fatty livers is very common. What about the SGPT, SGOT, how it will be? Because so many drugs that will pass through the liver, how they are going to. We can better educate them if we do all these tests. Renal functional test, liver functional test, and the lipid profile. These are the three things that are very, very important.
Perfect. So you already mentioned about the investigations. Now, of course, we add on the lipid profile to it as well and the liver function. Does echocardiogram also have a role, ma'am, or is it required only for women who are who are obese, or who are women who have a family history of hypertension, diabetes, etc., or themselves hypertension, diabetes?
I'll tell you, every alternate person after 50 years, either they are diabetics or hypertensive, because of the increasing obesity in India. That is why it is necessary to go simple ECG nowadays. I don't know why no cardiologist giving opinion on simple ECG at all. Everybody, instead of going for ECG, again going for echo, better to go for the echo at all. But I personally, I won't take a echo for everybody. If the patient is, she's not overly obese and her BP is under control, normal. If she is not having any complaints, I won't go for echo regularly. BP recording, that's what is the thing. Examine the patient first from top to bottom. They examine her breasts, her lungs, and blood pressure. These things, nowadays we forgot we should have a
So,
stethoscope and look into the patient at all. So these are all the things
absolutely.
that are very important.
My next question was that, and you stole it from my mouth. Mammography, is it mandatory for postmenopausal women?
Yes, we are doing mammography as a routine, because the incidence of breast is increasing. It has got nothing to do much with the osteoporosis, but in general, it is increasing. Again, high risk factors if you have mammography after 50 years, we are doing as a routine.
Thank you so much, ma'am. Yes, so beautifully again highlighted the point of about it. So now, ma'am, we were talking about the medication or the treatment that we will be talking about. So, ma'am, I will next be taking your call on HRT and its role on bone health. And also I will be asking you about the other treatment modalities that we can use in this postmenopausal woman.
Priyankur, we are
Ma'am,
gynecologists. We know what is the HRT and what is MHT and all. But for many of the just MBBS post students, I want to make it very clear. HRT means that is the hormone replacement therapy is only for the premature ovarian insufficiency patients, but is they are attaining menopause below 40 years. And for them, up to the age of the natural menopause, we need to give the HRT. But what hormones we give is the MHT, menopause hormone therapy. That is after menopause, we are giving one thing. HRT is first line treatment for premature ovarian insufficiency, but it is not first line treatment for the postmenopausal osteoporosis because it is not FDA approved. There are better drugs for the bone health than MHT. So, but definitely estrogens will help for the bone buildup and for bone health than placebo. Even very low doses of the estrogen is also very good, but they have got their own limitations. And window of opportunity we have to take it. Suppose if you are giving it for heart pressures or for vasomotor symptoms, good. It takes care of the bone health also. And second thing is recently in 2020, the International Menopause Society agreed for high-risk patients to prevent osteoporosis. We can give MHT. Previously, it was not there. This is the latest updated amount. If the patient is obese or if she's on corticosteroids or the family history of fracture for herself, it is the fracture that is present. In such patients, we can we can start for a preventive measure. Otherwise, it is not indicated.
perfect, ma'am. So I think MHT, yes, we can for bone health can be given as you say. And of course, for most of us, MHT probably means a supplementation of estrogen and or progesterone, depending on the presence or the absence of the uterus. But ma'am, a short take on from you on tibolone and raloxifene. Do you use it routinely in your day-to-day practice?
Before going for the tibolone or raloxifene, I would like to say for the audience, bisphosphonates is the first line of treatment. They should never forget about it. Many of the gynecologists, they don't prescribe. They will refer the patient to the orthopedic surgeon. Absolutely not necessary. It is a very safe drug. We can give bisphosphonates, either alendronate, residronate, or zoledronic acid base. You can take weekly. You can give monthly, or it can be given intravascular also. The good part of it is it reduces both the hip fracture, spine fracture, and wrist fracture by 50%. And it can be given orally for 3 to 5 years, or it can be given intravenous for 3 years. Do not measure BMD while on treatment. Again and again, I am insisting for that. Certain facts to remember is once established, osteoporosis cannot be reversed. That is why we have to give bisphosphonates to maintain the bone density. A little bit about the drug I want to tell because many people are not using. It is safe, you can use, and please listen to the menopause specialist while taking the medicine. For all the audience, I want to tell because they think that only calcium and vitamin D are going to help. No, calcium and vitamin D are inevitable accompaniments of the drugs. But bisphosphonates, I'll tell you, the first thing it should be taken in the morning, an empty stomach. Patient should be erect for 30 minutes after taking because otherwise reflex irritability will be present. Take with a cup of water. Don't drink any coffee or anything for about 2 hours. And because this drug gets accumulated in the blood, in the body, a drug holiday is necessary for this. Because you know what happens if they come to the doctor for prescription, they need to give the consultation. That is why once they take prescription, they use it for 10 years. No, don't do it like that because certain disadvantages are also there. So, drug holiday after 3 years, stop it and then take the drug holiday. And zolandric acid is the one 5 ml yearly treatment. Again, it is a 3 years is there. And you ask for the sums. What are the sums? It is the
Yes, ma'am.
raloxifene, bezodoxifene, and lasoxifene are there. But again, they are second line, not the first line.
First.
If bisphosphonates are contraindicated, then only you go for the raloxifene. Raloxifene, mind that there is a DVT is a problem, deep vein thrombosis, or there can be some myocardial infarction. So usually for a young patient, like hysterectomy happened at 30 years or anything like that, where bisphosphonates we cannot be giving. In such patients only, we will give it. And second thing is, it will exacerbate the heart pressures. That's why we should be very careful in prescribing this one. You asked about the Tibolon. I'm very happy. I love Tibolon. That is my favorite thing
Ma'am.
because it's a very good molecule. It is a selective tissue estrogenic activity regulator. The beauty part of it is it can be used in libido also because it has got the testosterone molecule in that one. It's very good. But only thing is, 1 year after stopping the menses only we should use it. We can't use it before. So that, and then the maximum period is only 65 years. In that way, any drug you are using, you should describe the pros and cons to the patient. With the mutual consent only, we should start using the things. There is one more drug is very, very important nowadays. It has come very recently. It is the denosumab. It's a monoclonal antibody and severe osteoporosis, though it is a second line of treatment. Suppose if severe osteoporosis is there, we can use it as a subcutaneous every 6 months because it is an anabolic one. And bone growth also is noted with that one. But
Great.
again, once you stop denosumab, the reverse will happen. Fractures will increase. That is why you should not stop like that only. You follow it up with the bisphosphonates. Don't stop it suddenly while
Ma'am,
giving
can you
the
just
denosumab.
tell us the dosage because most of us do not use it. So, like, is it weekly dose, bi-weekly dose, or is it on a how do we?
Once in 6 months,
Okay,
subcutaneous,
okay,
25 micrograms.
okay, great. So we have to, as you said, I think another important message which ma'am said about all the treatment modalities we have read, but then she talked about the monoclonal antibodies as well, and ma'am said that we do not stop it at one go, supplement it with bisphosphonates or either override it with bisphosphonates and then decide how to stop and what we need to do about it. So thank you so much, ma'am, for once again highlighting so beautiful about HRT and the other treatment modalities. And we almost are coming to an end of this session today. It's almost 8:50. So I would like to now finally wrap up this session by asking a few practical tips and counseling points. Number one, menopausal clinic, what are the things we need to see? These are for the new people who are here. Menopausal clinic, what are the things we require to start a menopausal clinic? What are the things that we need to see? And of course, the few tips and tricks that are required that we need to tell our patients that will probably help them in preventing osteoporosis. As you said, once it's osteoporotic, it's always osteoporotic.
Yeah, counseling, first and foremost is counseling, counseling, and counseling. And osteoporosis doesn't start in old age. It starts with negligence and start caring early for that one. Calcium, vitamin D, and movement, your daily trio for bone strength. Don't wait for fracture to remind you. Protect your bones today. Healthy bones are built by habit, not by chance. Eat right, move daily, stand tall. Your bones will thank you. Bone health is silent strength. Nature, you nurture it every day. And encourage women to know their numbers. What is your BMI? What is your DEXA score and all? But don't treat with that score. Reinforce lifestyle management. Again, repeating that is the diet and exercise is more important than directly jumping for the drugs. As you said, drugs are not going to treat everything. Our weight is not going to come down. You have to control your diet and all. Always I tell, the weight will not come from the air. That is why sannyasi will not be fat like us. It is only by eating whatever you eat, either excess of carbohydrates or fats, whatever it is, whatever you eat, you will get it. So, but regular follow-up also is necessary. We can't say that I've seen you for today, this is going to be lifelong. Need to follow regularly. I need to counsel regularly. And as a doctor, we don't have any social life. Always with the patient, counseling them, enjoying with their problems, nothing other than that.
Perfect. And finally, one take-home final message from you, ma'am, about menopause, bone health, whatever you want to say. One final line from you, which will take as a final take-home message from you.
Osteoporosis is a silent epidemic, but it is preventable. We can, with all these things, a healthy life if you're leading, I think we don't need to worry much about osteoporosis because even at this age, 70 plus, we are quite healthy because we are moving. We are doing our work. Don't stop working.
Absolutely, ma'am. So thank you so much, ma'am, for being here for this session today. Thank you for that wonderful message that you have given us. Osteoporosis is silent, but is definitely there, and we have to take care of all the women that we are here to serve. So thank you, Ambuja, ma'am, once more for being here.
Thank you, Dr. Priyankar. And I'd like to say my thanks to Monica and Evangel. And of course, finally, our own president. It is all because of her only. And thanks to Sunita Tandulwadkar for all the opportunity. And thanks to all the audience. I don't know how many are present. I thank them all. Thank you.
Absolutely, because today being Diwali, people have still tuned in to watch this program, and more importantly, you have been here, ma'am, for this
Oh, so
program. I'm
nice.
sure you have taken out of
So
your
nice of
family, and
you.
your family
Thank
might
you.
be cribbing, but then thank you so much, ma'am, for being here. It means a lot to all of us, and thank you for the wonderful message that you gave towards bone health, towards osteoporosis, that I'm sure is going to benefit a lot of them. Thank you once again. Take
Thanks
care,
a
and
lot.
we wish you all the best for this festive season of lights. Thank you so much. Thank you.
Good night. Wish you all the best, Priyankar.
Thank you so much, ma'am. Please take care. Thank
Bye.
you, ma'am. Bye
Bye.
bye. Thank you. Bye.